Good day, ma'am. I'm Cabiedes and I will be performing the nebulization checklist. So for the preparatory phase, first is to check the doctor's order and also check the patient's drug name and the dosage and frequency of medication. So this ensures correct drug and dose, and the order sheet is the most reliable source and legal record of the patient. Next is to identify the patient using identifiers and comparing these identifiers with the information on patient's identification bracelet. So here I am going to identify the name, birth date, and or the medical identification number. So identifying patients accurately and matching the patient's identity with correct treatment or service is a critical factor for patient safety. To prevent instances of misidentification and near misses, the Joint Commission requires that two identifiers, such as the patient's full name, date of birth, and or medical identification number, be used for every patient encounter. Next is to assess the heart rate, the respirations, breath sounds, and pulse oximetry. So this establishes a baseline for comparison during and after the treatment. Now for the performance phase, first is to perform hand hygiene and to arrange the equipment that I will be needing. So hand hygiene reduces the transfer of microorganisms and arranging the materials saves time. So here I have already gathered and prepared and arranged my materials that I will be using, on which I can conveniently use them when needed. Next is to explain the use of nebulizer equipment to the mother or significant other and warn about the possible side effects. So this helps make them more knowledgeable about treatment and medication. So good morning, ma'am. I am Cabiedes and I will be your student nurse for today. So for today, I will be performing nebulization, on which I will be using a medical equipment which is called the nebulizer, on which this will turn liquid medication into mist, so that the medication will be administered directly and quickly into your lungs. So common side effects of this is coughing, sneezing, and or mild wheezing. So if you have any concerns or you feel any discomfort, just tell me right away. Okay, ma'am? Okay, thank you. Next is to place the patient in a comfortable position or sitting up in a chair if able, or semi-Fowler's position. So this improves lung expansion and medication distribution. So for the infant, I can put pillow underneath the head, or also I can also carry and bring the infant to the mother for proper positioning. And here my patient, I have already placed her in a sitting position. Next is I will teach the patient the proper way of inhalation. So here I will be teaching slow inhalation via the mouthpiece, short pause after inspiration, slow and complete exhalation, and then some resting breaths before deep inhalation. So this improves effectiveness of medication. So ma'am, I will be teaching you breathing techniques to properly inhale the medication. So first is I will be performing and then you will follow. So first is to slowly inhale through your mouth via the mouthpiece, which we will be using later. And then slowly inhale and then have a short pause and then slowly and completely exhale. And then we will have some resting breaths before doing the deep inhalation. So follow me, ma'am. Slowly inhale through your mouth by the mouthpiece and then have a short pause. And then slowly and completely exhale. And then we'll have some resting breaths before deep inhalation. Okay, good job. Thank you so much, ma'am. Next is to assemble nebulizer equipment per manufacturer's direction. So assembly may vary slightly with different manufacturers. Proper assembly ensures safe delivery of medications. Then, add prescribed medication and diluent if needed to the nebulizer cup. So this ensures proper dose and delivery of ordered medications. Then I will now turn on the nebulizer machine and ensure that a sufficient mist is formed. So this verifies that the equipment is working properly during delivery of medication. Then I will have the patient hold mouthpiece between lips with gentle pressure and offer assistance until he or she can perform inhalation. So ma'am, can you hold this and put it to your mouth between your lips with a gentle pressure. Insert it between your lips, okay? Thank you, ma'am. So if the patient is unable to hold the mouthpiece, so I will replace the mouthpiece with a mask. And I will put it on the baby. So use of face mask does not require the patient to remember to hold mouthpiece correctly. So correct delivery ensures sufficient deposition of medication. Now, I will have the patient take a deep breath and slowly to a volume slightly greater than normal. Then encourage a brief and inspiratory pause, then have patient exhale passively. So this improves effectiveness of medication. So ma'am, can you inhale deeply, slowly, okay, slightly greater than normal. And then have a short pause. Okay, inhale deeply. And then have a short pause. And then exhale passively. Exhale. Okay, again ma'am. Inhale deeply. Have a short pause. And then exhale slowly and completely. Okay, thank you ma'am. If the patient is dyspneic, encourage patient to hold every 4th or 5th breath for 5 to 10 seconds. And then remind the patient to perform proper breathing technique until the drug is completely nebulized. So this maximizes effectiveness of medication. So ma'am, for every 4th or 5th breath, kindly hold it for 5 to 10 seconds. Okay, and please remember and do the proper breathing technique that I taught you a while ago. So slowly inhale and then have a short pause and then exhale. Okay. Then tap the nebulizer cup occasionally during treatment and toward the end of the treatment. So I will tap. When medication is completely nebulized, I will now turn off the machine. Rationale, tapping the nebulizer cup releases droplets that are clingy to the side of the cup, that allowing for renebulization of the solution. And turning off machine promotes comfort and safety. Monitor the patient's heart rate during procedure, especially if beta-adrenergic bronchodilators are used. So beta-adrenergic bronchodilators have cardiac effects that should be monitored during the treatment. On completion of the treatment, encourage the patient to cough after several deep breaths. So, ma'am, have several deep breaths. Okay. And then cough. Medication may help dilate airways, thus facilitate expectoration of secretions. Then, assess the need for percussion, vibration, and suctioning. So for the infant, when we do chest and back clapping, make sure not to hit the spinal cord of the baby. And then lightly tap the chest or back using my cupped hand. And then suction. Percussion and vibration is used to further dislodge and move the mucus where it can be coughed out of the body, while suctioning is usually done when a child has mucus that he or she is unable to cough up, which may block air passages. If steroids are nebulized, instruct patient to rinse mouth and gargle with warm water after nebulizer treatment. So this removes medication residue from oral cavity and help to prevent oral candidiasis, a possible adverse effect of inhaled steroid. For the follow-up phase, I will now perform hand hygiene and assist my patient to a comfortable position. So this reduces the spread of microorganisms and promotes patient comfort. Then I will now record the medication used, response to medication, and description of secretions. So, accurate and timely documentation and reporting promote patient safety. Then disassemble and store tubing assembly per agency policy. So proper storage reduces transfer of microorganisms. So that's all. Thank you so much.